All right, great. Thank you. For those of you who are just joining us, welcome. We are going to go ahead and get started with our Lunch and Learn today. We're going to talk about the IEP team and their roles and how we can work together. Maybe if I can advance. Here we go. All right, just a few ground rules as we get started. Just a reminder that our webinar will be recorded, and afterwards we will post it online on our YouTube channel in case we had people who were not able to join us today. I have gone ahead already and muted everybody during the formal presentation time. If you have questions, please feel free. You should see that chat icon up along the meeting information there. You can just submit a question online. Janelle is going to go ahead and keep track of the questions for us. And then after the formal presentation time, we will go ahead and answer those questions. If you do have a question, please let us know your name and where you're from, whether you're from Ohio or Michigan. You don't have to be any more specific than that. Also, if you have a question, please no use of any names, so the school name or the school district or any school personnel. And when we do unmute, if you could just speak one at a time for the purpose of interpreters and for captioning, that would be great. All right, we are going to go ahead and talk about the IEP team today and working together as a team. So it was interesting, as I was putting this presentation together, I searched, what is an IEP team? And the interesting part was I didn't get any definition of what an actual team is. It kept coming up with who are the members of the team. And so this is my comprehensive, I hope, definition of an IEP team. The IEP team is a group of people who come together based on their knowledge and expertise to review a student's academic, social, and functional abilities and their needs based on state educational standards. The IEP team will determine a student's academic, social, functional, and behavior goals in order to help the student learn, progress, and ultimately succeed in school and as an independent adult. So the IEP team has a big responsibility for a number of years for our students. Now, if you are familiar with IDEA, or the Individuals with Disabilities Education Act, it specifies who is a required member of the IEP team. So, at minimum, when you go to an IEP meeting, these people should be at the table. So parents, you are a required member of the IEP team. The student, as appropriate, should also be attending the meeting. I encourage parents to bring your student to the IEP meeting as early as possible. Now, that doesn't mean your student has to stay for the whole IEP meeting. I have seen students in second grade come into the IEP meeting and be able to give just a little bit of input. And depending on what those topics are, the student can tell you, even in second grade or third grade, what they like or what they don't like. Sometimes it's as simple as giving the student a choice as you're talking about speech therapy. When are we going to do speech therapy? Should we do it during recess, or would you like to be pulled out from this class? Ask the student and bring them in so they don't feel like it is this big scary meeting or that there's just a bunch of adults sitting around talking about them, because we really do want their input too. The general education teacher is a required member, a special education teacher or an intervention specialist, the local education agency. So this is IDEA language, and what that means is sometimes you'll hear it that person referred to as an LEA, or they're basically a school district representative, somebody representing the school district, and that's oftentimes the person from your special education department. You should have someone who can interpret the educational implication of evaluation results, and that's a lot of words for saying after we've completed an assessment, somebody who understands the assessment results and how we can apply it into the classroom, how it may impact the student's performance. Other people who have knowledge or special expertise regarding the student. This can be somebody that the school district invites in, or it can be somebody that you as a parent invite in. If you are inviting somebody into the meeting, let the school district know ahead of time so they're not taken by surprise. And because sometimes if it's a surprise, it can seem a little adversarial, which is not what we want. We just really want other people to be able to contribute their knowledge. And as your child gets older, a transition specialist, so this is for post-secondary education. So at age 14 in Ohio, and I believe it's 14 in Michigan too, or federally it's at age 16. Other team members that we might see can include anyone from this list here. It doesn't have to be all of them. And these are not required. So parents, you can invite them. Again, the school district can. You can invite a parent or a child advocate to attend the meeting with you, such as an ASTRA advocate. You can invite a friend or anybody else that you think might be helpful. If your student is using an educational interpreter, they should be at the IEP meeting. An educational audiologist, a speech-language pathologist. We do see a lot of deaf and hard of hearing students who are getting speech therapy. An occupational therapist, physical therapist, a language facilitator. This is something that's become more popular in Ohio, and a language facilitator is used generally for students who are transitioning from a spoken language to sign language, and so they're not quite ready to use an interpreter, and this language facilitator may actually be teaching them sign language. If your child has additional disabilities, you can bring in an expert on that additional disability. So if your child also has autism, bring an autism expert. If your child has ADHD, feel free to bring a person with that knowledge also. Many districts have a reading specialist, so if your child is struggling with reading, invite the reading specialist in. And if your child is placed in a deaf or hard of hearing program, you'll often see that administrator of the program attend the meeting. And oftentimes you'll also see the school building principal at the meeting. The principal can also be the designated LEA, or that special education representative, the district rep. So what if a required member can't be there? You as a parent, there are a couple things. You need to be notified before the meeting that, let's say the general education teacher, that the general education teacher won't be there. And if you feel like you're not talking about anything that relates to their knowledge or expertise at that particular meeting, you are welcome to excuse that teacher from the meeting. And if you do that, that needs to happen ahead of time, and it needs to be written. So you need to give written consent to excuse that required participant. If you go to a meeting and you walk in and you hear, I'm really sorry, but the general education teacher couldn't be here today. Will you sign this form to excuse them? What do you do? Because this happens sometimes. You as a parent have the right to say, I really appreciate everybody's time, but I feel like I have important questions for the general education teacher today, and I'd like to reschedule the meeting. Or you can go ahead and excuse that teacher. That is up to you. Okay, so we've arrived at the IEP meeting. We are all here. And the reason that we are all here is each team member, each required team member has a unique perspective, a unique background, unique experience to share and bring to the table. They all have a different skill set, unique credentials, which gives us all a different and unique input. Our goal with the table for the IEP team is to work together to create a student, I have a typo there, sorry. Our goal is to work together to create a student's goals using each person's knowledge and expertise. Building your IEP team can take some time. Sometimes the first meeting you go to might be a little awkward if you're just meeting people for the first time, but as you start to work together and you get to know each other, your team is going to work cohesively together. And in order to do that, we need to really listen to each other. We need to feel free to communicate openly and honestly. So if you have a question, you want to make sure that you feel comfortable that you can ask that. We want to make sure that we're respecting each other and each person's individual roles in that meeting. I put down here, listen to learn. We've got to make sure that we're hearing the other person's perspective. And in order to do that, we've got to make sure we put aside our own biases too. Sometimes maybe we've worked with that teacher in the past because we have an older child who has gone through that classroom, or maybe sometimes we've heard stories about from other parents who have a child in the district or who have had this teacher. So really try to put those biases aside. And then I always recommend to begin with the end in mind. So where do I see my child as an adult? So we've got to make sure we see the big picture and the ultimate goal that you want. Do you want your child to be successfully employed? Do you want them to go to college? What are the smaller steps that we need to take them there? And sometimes you can then work backwards. Okay. Again, here's just a little, teamwork. We are all here to work together. So what is your role in the IEP meeting? The general education teacher, I'm going to start looking at the required team members, and then we'll expand that a little bit. So the general education teacher is there to really represent state standards and represent the non-disabled standards. So what do we see typical peers doing at this age, socially, academically? They're kind of, they help us understand what's on grade level. The special education teacher, I want to say I always recommend if your district has a teacher of the deaf that your teacher of the deaf is there for your special education teacher. Sometimes districts don't have that, and it will just be a general intervention specialist, and that's okay too. This person is going to bring a knowledge of the disability and the needs of the student or the needs of that disability, specific disability, and help the general education teacher understand how to adjust the curriculum or to make appropriate accommodations within the classroom. Your LEA or the school district rep is somebody there who should have the power to make authorizations and approvals within that IEP meeting, such as financial decisions, which are often important. It come down to something like transportation, could even come down to staffing decisions. So they should be able to know, yes, we have this, we have this consultant available who can come in and work with the student or be part of the IEP team. The evaluation expert, who's also a required member, like I said, often the school psychologist, they're there to help the team understand the assessment and evaluation results and how that will impact the student's academic, social, and functional skills and learning on a daily basis. The transition specialist is going to have a knowledge of outside agencies to assist with life after school. I'm hoping that as we're going through this and talking about the roles of each person, you can see the value that each person brings, because there is a huge knowledge base in that room, and we can't expect one person to understand all of that. So we can't expect the general education teacher to have a knowledge of transition. It's a lot. And, even as an advocate, I know that I can't know it all. So sometimes we have to bring in an advocate who has a different skill set and knowledge, if it's a different disability, to bring to the table too. So the student, we always want the student there, like I said, as soon as we can. And they have the ability and they have the responsibility to make sure that they're expressing their likes and their dislikes. They can let us know what their preferences are in regards to learning, or especially for our kids, visual preference or auditory preferences. Let us know what might be hard for them. And you will see the student role is going to get more involved the older they get. So, in second grade, that they won't be making the same decisions as they're making as a sophomore in high school when they're talking about their transition plan. So The speech-language pathologist is going to bring in expertise on a couple areas that are important to our deaf and hard of hearing students, articulation and language development. So sometimes it's easy to forget that there are also our language specialists. So they can help us understand where a student's language development is, and then the general education teacher and the special education teacher can take that information and apply it on a daily basis to the curriculum and the student's IEP goals as a team. The educational audiologist is there to kind of help bring the medical piece and the medical side and understanding and help us understand how that is going to relate functionally within the classroom. So we know that oftentimes we can see students who have the same audiogram on paper, but when you get into the classroom, what we see functionally are two different students. So they can help the IEP team understand this is what it says on paper, but this is what we see in real life. The educational interpreter is not required, but if your student is using an interpreter, I would definitely recommend that they are part of the team. They can provide us with some observational data, including your student's language and accessibility, use, and needs. So, you know, how often, if you have a student who's wearing cochlear implants and using sign language, what's their preferred mode? Do they like to listen more? Are they more of an auditory listener, or do they like to use the American Sign Language for support? They'll let us know, do they like American Sign Language more, or do they like Pidgin Signed English more? And those are important to know as we're writing goals and providing accommodations for students. So parents, I really feel that we have the biggest role in the meeting because we have, number one, we are emotionally invested in our student. And number two, we have a lot of pieces to fit into this puzzle. So parents, your role, you have a role before, during, and even after the IEP meeting. Number one, you want to make sure that you're asking questions. So sometimes these questions will come before the meeting, and oftentimes they will come actually in the meeting. So parents, make sure you're asking questions. And you want to bring to the table your knowledge of your child's strengths and their needs, his or her likes or their dislikes. You know your child best, including their abilities and their needs, so don't be afraid to tell the team what your observation is and what you know about your child. You also have the role, if you have outside therapists or specialists working with your child, outside reports, that you want to bring that information to the table too. Oftentimes it's very useful to the rest of the IEP team either to know, yes, this therapist sees the same thing that we do, or, hey, this student is behaving differently in one-on-one therapy versus in the classroom. What's the difference? Are they more comfortable in this environment? To kind of help ask some more questions and figure that out. Sometimes, as parents, depending on your school district, we see this a lot in smaller districts. Sometimes we also serve as the expert on deaf and hard of hearing students. Sometimes we find that we're teaching the IEP team about the needs of our deaf students. Most importantly, you're an advocate for your child in this meeting. So we always want to make sure that we are maintaining focus on the student and what their needs are and what the goals are for the student. And parents, you are also, in essence, a case manager for your child. You are the glue that kind of holds everybody together. You're maintaining records for your child from the school district, from outside reports, from earlier intervention. You have that history and knowledge base of your child. You have seen the yearly progress. You have seen what works for your child and what doesn't work. Sometimes we are there to help facilitate and coordinate communication. And when I say that, I'm actually thinking more kind of outside of the meeting, but still bringing all of our therapists and providers together. I think a lot about outside providers knowing, hey, I can talk, you know, I'm giving you permission to talk to my child's school district so we can coordinate care for my child. Okay, so that's a lot of information, and I think I see some questions on the chat box. I'm going to come to Janelle and see if there are any questions. Janelle, do you want to jump in there?
Sure. We did have a question regarding someone asking whether they can get a printed copy of the presentation afterwards, if you will be posting that anywhere.
Sure, I can. Generally what I will do after the Lunch and Learn, I will send you an evaluation and a link to the YouTube video so you can rewatch it, but I can also include the PowerPoint slides. That's no problem.
All right, this is Janelle. Thank you. I don't believe there were any other specific questions that came in to ask you. However, I do have a question for you, Tabby. Since I'm coming from Michigan, the answer might be different from Ohio, but this is something that I have seen before happens, and maybe you can clarify the role between a teacher consultant or educational consultant and what an educational audiologist would do, or a speech therapist. Like, what is the difference between that teacher consultant and those other specific roles? We have seen in a couple cases where the school, is satisfied with just having a teacher consultant in. However, the parents have felt that they needed an audiologist.
So I just want to make sure that I'm clear. So when you say you're educational consultant, you're speaking of a teacher of the deaf or hard of hearing who's
yes
coming in. Okay, so what's the difference between a teacher and an audiologist?
An educational audiologist, yes.
Yes. So the educational audiologist is really going to focus on the physiological part of the child's hearing. So they're going to test, they're going to say, they're very standard. This is what your child can hear. They can hear within a normal range with their cochlear implants on. And they would also handle any sort of assistive technology that your child might be using in school. So if they're using an FM system and the pieces and parts that need to be ordered in order to make connections between your personal cochlear implant or hearing aids and what the school is providing for a listening device. So they can also manage the equipment side of that, whereas a teacher consultant or a teacher of the deaf or an educational consultant is really looking at the educational part of learning, whereas the audiologist is looking at more the medical side applied in a classroom. And so the teacher of the deaf will understand kind of how a deaf child learns, whereas an educational audiologist doesn't necessarily understand that neurological component of how a student learns in the classroom.
Thank you.
Does that make sense? Or do
yeah.
you have anything to add?
No, that was great, Tabby. I just wanted them to understand the differences. We do have a couple more questions. I'm going to read them to you if that's okay.
Yes.
All right. Our first one comes from Amanda from Michigan, and she said, can you describe what makes up the evaluation team when a child is going through their 3-year reevaluation for their status of qualifying for an IEP?
Yes, the evaluation team is very similar to the IEP team, so you will see a lot of the same members, but it's not always the same. So the evaluation team can also be composed of any specialist who you suspect there might be a delay. So you can add in, and this should be a form that is decided upon ahead of time. So your special education representative should be going through with you and say, do you have concerns about your child's gross motor skills? Do you have concerns about your child's fine motor skills? Do you have concerns about your child's social or behavioral needs? And so beforehand, kind of going through with you and saying, do you have concerns in these various areas? And then those members, and then you'll see a little checkbox, so yes, and we're going to have that area evaluated or not. And then they will come together. The evaluation team's purpose is to determine if the child has a disability that will impact their educational performance, adversely affect, is that federal lingo. So if the evaluation team is essentially determining an initial disability or a continued disability, whereas the IEP team is determining, they're taking over after the evaluation team has said, yes, your child has a disability, and now the IEP team is using the information from the evaluation team and writing appropriate goals for academics, behavioral, functional needs so the child can progress.
Thank you, Tabby. We have 2 more questions here, so I'm going to try and get through here quickly. We only have a couple minutes left. This is from Camille from Ohio, I believe. She said, any suggestions on how to convince a team to add a specialist who isn't currently on the team?
Yes, a couple of suggestions. Number one, I think you would want to look to find your ally on the IEP team who says, yes, I need somebody with a little bit more expertise to help guide me also. And I have to find it, but I have seen an article about why a teacher of the deaf should be on an IEP team. And so let me find that resource and send out to you and it explains the teacher of the deaf role versus a general intervention specialist or a general education teacher.
All right. Wonderful. Okay, so this question comes from Shakun from Michigan. Who would be the person that interprets the educational implications of evaluation results? Is this person someone who relays the results in layman terms to the parents, or someone who provides the IEP team with evaluation outcomes?
So most often we see that person as the school psychologist who is trained to interpret assessment results and the implications. Yes, the school psychologist should be able to relay that information to parents in layman's terms so we can understand, because there's a lot of information and it gets very technical on some of these assessment results. So they should be able to put it in a language that parents understand. And then sometimes we do see, when we're talking about very specific categories, let's say speech language, sometimes that speech therapist can also help interpret those results and help parents understand what that means in an educational setting. So sometimes the actual therapist can do that too.
Thank you. We have one more comment, and it comes from Beth from Michigan. She said that the Educational Audiologists Association has a titled document titled Recommended Roles of Educational Audiologists and Teachers of the Deaf and Hard of Hearing. And she sent that to address that first question of the different roles between the two. So that's found in the Educational Audiologists Association.
Great, thank you. And that may be the document that I have seen before, Beth. Thank you for finding that link. I think just to tag on to that, when Camille asked how do we convince the team, I think we just let the team know that bringing in an additional specialist is to everybody's benefit, and mostly to the student's benefit, to keep the student progressing and learning. So just a reminder, I'm going to go ahead and wrap this up. Thank you all for attending today. I will get this recording posted online for us. I will send the evaluation result out for you. And then just to let you know also, our next Lunch and Learn will be in February, and that is on February 21st at noon, and we will be discussing hurdle talk. So when you're in an IEP meeting and you've made a request and the IEP team seems a little bit hesitant or they give you an objection, how can you overcome that objection and get a service that you feel your child might need? So I hope you can join us. That registration link will be up also soon, and I can include that in our wrap-up email from today. So thank you all. Again, if you have any questions, please feel free at any time to contact Janelle or I, and we would be happy to help you out.
Thank you, everyone. Have a great day.
Thank you.